Chapter 3, Treatment Procedure. Before administering treatment, determine your client's skin type by referring to the Fitzpatrick scale in your instruction material. Clients with very light hair growth, blonde, gray, and red, will require additional pigment in the form of carbon dye before treatment. Be sure to thoroughly clean the skin with ethyl alcohol after carbon dye application. And remember, eye protection is mandatory for both the technician and the client. Deliver 120 to 180 joules per centimeter squared to the client's treatment area for the most effective results. And carefully watch for the symptoms of overtreatment. Chapter 4, Post-Treatment. It is normal for the skin in the treatment area to experience some degree of vasodilation. This is considered a sign of success, as the skin is reacting to the trauma inside the follicle pore. The use of a topical lidocaine or aloe gel is recommended. Regrowth after treatment is normal. Most of this activity will be coming from follicles which were dormant at the time of the original application. Follicles can only be destroyed in the early anagen phase, which occurs once every 90 days. Most clients respond very well to a series of treatments over 4 to 6 weeks. 8 to 10 treatments over the period of 90 days produces the most lasting results.